Now, I think it's helpful to know about the subtypes. How many of you know what the difference is between bipolar 1 and 2? Okay, a couple of you do, so I think it's worth our spending time on. The DSM has some pretty Byzantine rules about this. A bipolar 1 person is someone who has a full manic episode, complete with decreased need for sleep, elated mood, grandiosity, pressure of speech for at least a week. And in fact, all you need is to have had one manic episode and you're called bipolar 1. The presumption is that eventually you'll develop a depression. We know that not everybody does develop a depression, but if someone has just a full manic episode, we call them bipolar 1. Usually we're using that term to describe people who cycle back between full depressive episodes and full manic episodes. To be distinguished from the type 2, which is alternating between severe depression and hypomania. Hypomania looks a lot like mania, but it doesn't last as long and it's not as impairing. So a bipolar 2 person has the same symptoms, decreased need for sleep, irritability, racing thoughts, but it doesn't cause major impairment, but it might be noticeable to others. During hypomania, you can ask questions like, so when you were acting like that, did you lose your job? Did it cause problems with your family? They usually say, not really. People said I was hyped up. They said they noticed, but it wasn't really any big deal. This gets missed an awful lot. Most often people say, well, I've just had depression, and you really have to dig to find out if there was a hypomanic episode, but it might be important from the vantage point of what drugs they're going to respond to. So the other thing that's interesting about this is people with bipolar 2 spend most of their time depressed and occasionally get hypomanic. The actual statistic is they spend 37 weeks depressed for every 1 week they spend hypomanic. That's also true in bipolar 1, but the ratio is more like 3 to 1. So they'll have, if they have both depression and mania, they'll spend 3 weeks depressed for every 1 week manic. The rest of the time, about 50% of the time, they're feeling okay. So these are the two major types. And we don't always know whether the person has a full manic episode. So we have a hedge category. We call it other specified bipolar disorder. Used to be called BPNOS, bipolar not otherwise specified. Let me describe it first and then tell you why I think it's important. These are adolescents and sometimes young adults who have these short episodes of mania or hypomania. They might have, it's supposed to say 4-day, not 14 days, 1 to 4 day episodes of elation or irritability, but they don't have all the B symptoms like decreased need for sleep or racing thoughts. They have these short mini episodes that are recognizable. They go through highs and lows. Maybe sometimes people just say they're moody, but and this might happen, say, for 10 illness days in their entire lifetime. We suspect these kids are at risk for developing full bipolar disorder. So this is a risk category. They're especially at risk if they also have a family history of bipolar disorder. So if you get an adolescent who comes in and they describe these couple of day periods of being amped up and juiced and whatever other words they use, and that it lasts a couple of days and then they're back to feeling okay, and then they get depressed for a couple of days. That might be otherwise specified bipolar disorder, but they never quite meet the criteria for full mania. Those kids, like I say, about 50% of them will develop full bipolar disorder in the next 5 to 8 years, especially if there is a family history. So that's a risk category, other specified bipolar disorder. Many of you may know the term psychothymic disorder. That's another category we use for people who have this sort of repetitive going back and forth between short periods of hypomania and subthreshold periods of depression. The distinction I make is, did they ever have a full depressive episode? If they had a full depressive episode, they're probably in the bipolar 1, 2, or otherwise specified camp. But if it's one of these kids who has, or people has two-day hypomania, has 2-day depressions, but there's an awful lot of them, it almost seems like a personality attribute. That's what we call cyclothymia. Has to last at least 2 years. The functional impairment is not as severe. Sometimes there's even the question about whether these should be treated. The reason we think about treating them is that they may transition to full bipolar disorder over time, and they often have a family history of bipolar disorder. So it's a choice point. Is it causing trouble for them? If not, it may be wait and see or give some psychotherapy before going the full medication route.